Greetings. Let us talk about percutaneous endoscopic gastrostomy tube placement, PEG tube placement. These are my acknowledgements, and today's learning objectives include the indications for placing a PEG tube and how do we set it up and assist PEG tube placement. PEG tubes are typically considered in patients whose oral intake is not sufficient. If it is only for a few days, you can manage with a nasogastric or a nasojejunal feeding tube placement. But if the need is going to be for several weeks, then PEG tube is considered. Typical examples include someone who had a stroke and unable to swallow, and the swallowing function is not recovering, or patient with head and neck cancer undergoing chemotherapy and not able to swallow and meet the nutritional needs, or someone with a progressing disease like ALS, amyotrophic lateral sclerosis, who cannot swallow and needs nutritional support, or someone who can swallow but nutritional needs cannot be met because of the high need for calories, such as patients with cystic fibrosis. Before you place a PEG, it is important to give preoperative antibiotics, typically 30 minutes before the procedure. When it comes to PEG tube placement, there are several different varieties. Here you see a pull PEG tube. This is pulled out of the stomach with the help of a wire that is attached to the loop that you see, or a push PEG tube that is placed over a guide wire and slid over the guide wire, or an introducer PEG tube where a track is made between the stomach and the abdominal wall, and then the PEG tube is introduced from the skin into the stomach. Tubes come in different sizes: 24 French, 20 French, and even smaller tubes. So before you set up the PEG tube, you should ask the endoscopist what is his preference: pull PEG, push PEG, introducer PEG, and what size, 24 French or 20 French, so that you pick the right tube that the endoscopist would like to put in. So among all these tubes, pull PEG tube is the one that is most commonly used, so we will learn about that. And let us look at what the setup includes. It comes in a kit, and when you open the kit, you will find a lot of items that are used for different steps in placing a PEG tube. Antiseptic solution to clean the skin, a sterile sheet to keep the operating field sterile, local anesthetic, syringes to anesthetize the skin, a scalpel to make the skin incision, a needle cannula to insert the guide wire, and once the guide wire is in the stomach, you use a snare to pull the guide wire out of the mouth, and you attach a PEG tube to that guide wire and then pull it back. That's why it's called the pull PEG tube. And when you pull the guide wire, you pull the PEG tube from the mouth, esophagus, stomach, and then through the abdominal wall out. And once the PEG tube comes out, you want to fix the PEG tube with an external bumper. And placing this external bumper is critical because it prevents the PEG tube from moving in and out and by preventing that movement, it will create a stable track between the stomach and the abdominal wall, which is important. A clamp to open and close the PEG tube. A scissors. After the PEG tube is placed, you cut the PEG tube at a desired length and attach a Y port that will be used for infusing either food or medications, and an antibiotic cream that is placed at the skin incision with a gauze over it under the external bumper. So you have learned that there are a lot of items, each one with a specific purpose. So let us go and see how we place a PEG tube step by step. So step 1 is sterilizing the skin. And if there is any hair, you should remove it, but you should avoid shaving the skin. Instead, use a clipper to remove the hair. And when it comes to sterilizing the skin using the local antiseptic solution, preferably chlorhexidine, and you start in the center and you work in circles until you sterilize or disinfect the skin from the costal margin all the way to the level of the umbilicus, covering the upper quadrants of the abdomen. So once the skin is cleaned out, then you are ready. You place a sterile sheet, and the endoscopist puts in the endoscope, examines the esophagus, stomach, small intestine, and once he comes into the stomach, he will ask the assistant to transilluminate, and the transillumination will show up if there is no loop of intestine between the stomach and abdominal wall, and you should see for the transillumination through the skin. You want to pick a site for placing the PEG, and the best site is at least 2 inches or 2 finger breadths away from the costal margin. And once you see the transillumination, you do the finger impression, and if you can see the finger indentation, you use a marking pen and mark the site. And once you mark the site, the next step is trying to do the PEG tube placement. So you take the local anesthetic, at least 5 cc's, and inject the local anesthetic, anesthetizing the skin and the subcutaneous tissue and the tract. And then after that, you insert the needle into the stomach to see if you can find a direct track into the stomach. And once you confirm that you have a straight shot into the stomach, and you can see the needle in the stomach, the next step is, as you're pulling the needle out, the endoscopist, once the needle leaves the stomach, he tries to put a little bit of suction on the syringe to see if there is any air coming out before the needle comes out of the abdominal wall. If air comes into the syringe as soon as the needle leaves the stomach before it enters the abdominal wall, it indicates that there is either a small bowel loop or a colon loop in front of the stomach wall. And if that's the case, that puncture site should be avoided because it could cause entrapment of the bowel and bowel obstruction. The next step is you incise the skin at least 1/2 inch, skin and subcutaneous tissue, and giving that good amount of incision will help you pull the PEG tube out easily. And then the next step is insert a snare into the stomach so that the snare is ready and to catch the needle catheter that will be introduced from the skin into the stomach. As soon as one sees the needle cannula into the stomach, the assistant opens the snare and the endoscopist reaches out to the cannula and snare the cannula plastic sheath to hold on to that. Next, remove the needle cannula and then insert the guide wire through the plastic sheath. And once the guide wire is in the stomach, gently loosen the snare, and the snare will slide down the plastic sheath onto the guide wire. And as soon as the snare slips onto the guide wire, grasp the guide wire with the snare firmly, and once that is secure, the endoscopist removes the endoscope and pulls the guide wire out through the mouth. During this process, you feed the guide wire so that it comes out easily. And once the guide wire is out of the mouth, you open the snare and hold on to the guide wire. Take the PEG tube and loop it around like shown here. Loop the guide wire around the PEG tube, and that is very important. And tighten the knot between the guide wire and the PEG so that it's a nice smooth knot, not a big knot, so that pulling the knot through the abdominal wall will be easy. And then press on the abdomen with the hand and pull on the guide wire out of the stomach. As the PEG tube enters the mouth, make sure it is lubricated well, and continue to pull the PEG tube, and the endoscope follows the PEG tube to see what is happening along the way. Continue to press the hand on the abdomen. This makes it easier to pull the PEG, and continue to pull the PEG until the internal bumper tugs. Usually it happens in a thin person between 2 to 3 centimeters. In somebody who has thicker abdominal wall, maybe 3 to 4 centimeters. And then once it's done, you cut the tube to the desired length. Place the external bumper over the tube close to the abdominal wall. Attach the clamp to the tube. Attach the Y port to the end of the tube. Apply antibiotic cream and gauze between the skin and the external bumper. Keep the external bumper a little bit tight to prevent any bleeding. And the PEG tube could be used for feeding after 4 to 6 hours. And on day 1, 24 hours later, remove the gauze, loosen the bumper by at least one mark, and make sure they rotate the tube so that there is no embedment of the PEG inside. It's important to educate the patient and the relative about PEG tube care. So we have learned about how to place a pull PEG tube. There are multiple steps, and it's important to learn how a PEG tube is placed. This is one of the commonly used procedures in hospitals and ambulatory surgical centers. I hope it is useful. Thank you.